Assessment of School-Aged Children by Rachel Mitzel and Sharon Daniel, and Partial Fulfillment of Nursing 551 for Dr. Susan Petrin.
Hi, my name is Sharon Daniel and I'm a student of PsycNP. Today I'll talk about screening, anticipatory guidance, and safety consideration of the school-age children. Healthcare providers use health screenings to detect a wide ranges of diseases and conditions. Early childhood health screening look for signs of blood and metabolic disorders, heart defect, developmental delays, autism, and other health problems. Early detection can lead to an effective treatment and prevention problem down the road. For screening purposes, we have to assess and evaluate factors like vital signs, HB, hematocrit, cholesterol, lead poisoning, dental care, vision, gross motor skills, fine motor skills, language, cognitive development, immunization, and ego development. The vital signs of school-age children are gradually becoming closer to normal adult values. The temperature can now be taken in the mouth because the child understands how to hold the thermometer. Average temperature ranges from 98 Fahrenheit to 98.6 Fahrenheit. Respiratory rate ranges from 16 to 25 breaths per minute. Systolic blood pressure ranges from 96 to 112 mmHg. Diastolic blood pressure ranges from 56 to 66 mmHg, and heart rate ranges between 70 to 80 beats per minute. Hematocrit ranges should be between 33 to 47, HB 11.5 to 15.5, and cholesterol should be less than 170 milligram per deciliter. For lead poisoning, anything greater than 10 micrograms per deciliter increases risk of neurobehavioral problem and cognitive development. For dental care, 4 teeth erupt every year until age of 12, and the fluoride concentration in the water should be more than 0.7 ppm. If fluoride concentration is less than 0.7, in areas where fluoride concentration is less than 0.7 in the drinking water, the provider should recommend supplements. Children in area with fluoride concentration of 0.3 to 0.7 ppm in the drinking water should get fluoride supplement of 0.5 milligram per deciliter. Vision should be 20 by 20 by age of 8. Gross motor skills, school-age children will be able to roller skate, skip, hop, and softball. For fine motor skill, we'll assess for how they dress up, if they're able to tie their shoes, draw a person with 12 parts. For language, we will be assessing how they expressing if they're able to express their feelings, or if they're following commands, or how the development of language pattern in them. For cognitive development, if they're organized and have rational thinking, they are less egocentric, they can write, spell, read, and understand. For immunization, at the age of 5, did they get a 5th DTaP and a 4th IPV vaccination? And the age of 11 to 12, we'll make sure that they got their TD, Hep B, and varicella vaccine. For ego development, we will be evaluating how competent they are at tasks and projects, and increase independence and self-esteem. Anticipatory guidance. Anticipatory guidance is given by the healthcare provider to assist parents or guardians in the understanding of the expected growth and development of their children. Parents should be taught that growth of school-age children normally follows the child's growth curve, but deviates at the growth spurt. Teach the child about the body changes that are going to take place. For girls, breast enlargement occurs between ages 8 and 11 years. Axillary hair and pubic hair growths begin at the age of 10 and 14, and menarche occurs between the age of 10 and 16 years. For boys, testicular enlargement occurs between age 10 and 12 years. Axillary hair growth begins between ages 12 and 14 years. Facial growth begins between ages 11 and 14 years, and pubic hair growth occurs between ages 12 and 15. Advise parents that sexually oriented play and masturbations are common in this age group, but children should be taught that masturbation should be done in private. Discussion about alcohol, tobacco use, and drug use should be included and emphasized more as children reaches puberty. Sex education such as books and videos may be suggested to help parents discuss these changes with their children. Emphasize the need to keep communication open between parent and children. The school age years are a time when healthy or unhealthy dietary habits can become ingrained. Parents and school age children should be reminded of the importance of healthy, balanced diet to facilitate normal growth and prevent obesity. Children should be taught to distinguish between nutritious food and junk food, and taught to avoid non-nutritious, high-calorie, high-fat, and high-sugar snacks and foods. They should have no more than 2 to 3 cups of skim milk per day and regular balanced meal with food from 4 basic food groups. Children should have 3 nutritious meals and 2 healthy snacks a day. At this age, children should be encouraged to become involved in planning, shopping for, and preparing for meals. Now we discussed about the recommended daily nutrition for school age. Fats used sparingly, breads and cereal 4 or more servings, fruits and vegetables 5 or more servings a day, milk 2 to 4 cups a day, meat, eggs, beans, and lentils 2 or more servings a day. Safety considerations. Injuries from drowning, falls, fires, and bike accidents are top concerns, so it is important that they learn to stay safe while still letting them be kids. At this age, their well-being is still in the hands of their parents or their caregivers, so we have to teach them and remind them to explore the world safely. School-age children are more independent, but their motor and cognitive skills are often inadequate to protect them from injuries and death from accidents. In fact, more children in this age group die from injuries than from all other diseases combined. According to American Academy of Pediatrics, most of these accidents are preventable, so parents should be made aware of the steps they can take to protect their children. Anticipatory guidance must be included: sports safety, water safety, stranger safety, car safety, and firearm hazards. Sports safety. Children should be encouraged to participate in sports to prevent the growing problem of obesity and to promote a healthy lifestyle. Safety equipment must be used to prevent injury. Children always should wear a helmet when rollerblading or riding a bike, skateboard, or scooter. Children should avoid riding in the dark. Protective knee pads and elbow pads also should be used for rollerblading and riding scooters and skateboards. Water safety. Children should never swim or play in water without the supervision of parents or responsible adults. They should be taught to always enter the water feet first and never swim in canals or fast moving water. Stranger safety. Parents must warn their children about the risk of being lured away by strangers. They should practice scenarios of what their children should do and say if approached by a stranger. School-age children also should know to dial 911 in case of emergency. Car safety. Parents should be advised that the best place for school-age children to ride is the back seat. Both lap and shoulder belts should be used, and everyone should buckle up before the car is started. Firearm safety. Parents should be told that the best prevention for accidents with firearm is not to keep one in home. If a gun must be kept in home, then the gun should be locked in a separate lock cabinet. Parents also must counsel their children on what to do if they encounter a gun at a friend's house or at school. Parents should be reminded to ask the parents of child's friend whether they are gun kept in the home.
According to Paget's cognitive developmental theory, school-age children go from the pre-operational phase to the concrete operational phase. Their thinking becomes more concrete and organized. They're less egocentric, more flexible. They can start to see other people's viewpoints. They acquire skills of conversation, transformation, reversibility, seriation, and decentration. Their writing and spelling, reading, and problem-solving abilities all improve during this phase. Erickson's industry versus inferiority. In the development of ego in school-age children, there is a movement towards increased competency in tasks, higher self-esteem with success. Their sense of industry makes them easily bored and irritable, and if they're not engaged in activities, they might lose interest in learning. The feeling of inferiority develops if they are unable to learn new things, and children might lose interest in all learning if this need isn't being met. Developmental milestones. Physical development of school-age children. In school-age children, the hand-eye coordination improves. Kids can read, write, and draw more accurately. They continue to grow, but at a slower pace. Their baby teeth are replaced by permanent teeth. They enjoy games and activities that require more skill, physically and mentally. More coordination. Intellectual development. They will start to ask more questions. They can sit still for longer because they have an increased attention span. They can acquire reasoning skills like cause and effect. They can master more complex tasks and subjects like categorizing by size. And they can follow serial commands. Language developmental milestones in school-age children include learning or adding about 5,000 words a year to their vocabulary, improving on grammar. They can express their feelings and thoughts verbally. Children who have expressive and receptive language problems are at a risk for impaired social interactions. They tend to get in more fights, tend to backtalk, and act like the class clown. Emotional developmental milestones for school-age children. They tend to show less fear than they did in early childhood. They have increased academic, family, and physical change stress. Those with high self-esteem handle this stress more effectively. And at this stage, they may try to hurt other children's feelings rather than physically hurt them. Social developmental milestones for school-age children. They could seek opportunities for social support outside of the family. Social acceptance by peers is really important to them. They're more responsible for their own behavior. They can consider how other people might feel. They're better able to understand property rights of others. They can follow rules, and they fear punishment. Moral development. They understand many rules are flexible and can be changed. They develop a conscience, an inner sense of right and wrong. They care about what others think. and they can learn by example. Common acute care or chronic comorbidities found in school-age children. In the head and neck, you might find lesions, nits, lice, or alopecia, especially tension alopecia caused by putting hair in a ponytail. Visual systems, you can find tearing, redness, cloudiness, protrusion, and jittery eyes, chalazion, or allergic shiners. Respiratory symptom, you can look for pectus carinatum or pigeon chest or gynecomastia. Ear, nose, and throat, allergic rhinitis, halitosis, or malocclusion. Abdomen, search for masses or pain. Cardiovascular system, clubbing of fingers, innocent murmur, arrhythmia, rheumatic heart disease. All these things would tell you that something is not normal. Musculoskeletal system, look for scoliosis, transient synovitis, leg calf herpes, growing pains. Genitourinary system, sexual abuse, pinworms, infestations, fissures, and phimosis. The neurological system, assess for hyperactive reflexes. This might indicate upper motor neuron disease. References.